you clarify what exactly has been happening with the mission here in Jamaica and what really has been going on?
Okay, the reality is that the mission allows for medical professionals to come for a period. As it turns out, and maybe coincidentally, this period has now come to an end for a number of them. And so a number will go back for others to come. In some instances, extensions are granted, but it's granted up to a particular point. The other coincidence, if you will, that is taking place is that currently we are renegotiating the MOU with the Cuban government. So there is a conversation that is taking place, looking at the existing MOU, looking at the possibilities for change. And so there's an opportunity, given the recent discussions coming out of the US, the program, for us to clarify issues and maybe adjust elements of the agreement. And that conversation is now taking place. I've always maintained myself as the Minister of Foreign Affairs and Foreign Trade relates on the diplomatic front that the conversations around the concerns raised and the discussions that have taken place have not been hostile. There is a sort of attitude of collaboration for us to come to a recognition or an agreed position. We have also maintained that the Cuban program has been very beneficial to us. We have seen hundreds, if not thousands, coming to Jamaica, providing valuable service in the space. And we have also said that in terms of our treatment of our Cubans who come, it has been no different from our treatment of our locals, except for any additional support based on the fact that they are not locals, so transportation, logistics, housing, and so on, which we would provide for any expatriate that would come here working in the government space. So, as of now, nothing changes. For now, the program is as is, but there's a conversation taking place around the MOU as we attempt to bring that facility.
Minister, can you say how many persons are needed now based on the expiration and how many are in the system? Do you have those figures?
I don't have the exact figures, but there is some overlapping. We have about 400 or so health professionals here. Normally a third or so others coming here. We had a team that went to Cuba some months ago because we actually participated in interviews and helped in the selection of persons who come. And so I know there's a group that is due to come. And so it's really a changeover of personnel.
In respect to the Cuban eye care program, is that affected as well? Because I know we usually have a program separately where that is concerned.
The Cuban eye care program is a specific program that falls on the same basis of the Cuban health care program collaboration. That program continues. It's an extremely valuable program based at St. Joseph's Hospital and at KPH, and that program continues.
There seems to be some concern about around the compensation part of it from the US side. How does that work? How are they compensating?
Well, I'm not privy to go into detail, especially when a discussion or negotiation is taking place. What I will say is that we are attempting to find a common ground with all concerned, our chief trading partner, the US, and also a traditional and very beneficial relationship